Welcome to Season 3 of the To Health With That podcast, where we break up big topics into small bites. I'm your host, Dr. Amy Newsel, and I'm joined by my dear friend, women's health and fertility expert, naturopathic physician Kate Nomas, to break down infertility, hormones, and the whole baby-making shebang. This week, I'd really like to talk about how does an ND work with some of those different underlying causes of infertility? Because in a previous episode, we mentioned that the most common identifiable female factors, which is roughly 81% of female infertility, is either ovarian or uterine.
Exactly. So yes, and within ovarian causes, you can find different ovulatory disorders like PCOS or thyroid, especially hypothyroid, or oocyte aging, egg aging, that we often see with advanced maternal age or premature ovarian insufficiency.
I've just got to say, I love the word oocyte.
Me too.
Just want to repeat that a few times. Oocyte. Well, tell me about oocyte aging. So you mentioned that. Tell me a little bit about it.
Exactly. So when we're thinking about oocyte aging, we're usually thinking of advanced maternal age or premature ovarian insufficiency. Advanced maternal age is just we're aging and our eggs are aging. And so our eggs aren't as healthy. They're less likely to end in a pregnancy. And then premature ovarian insufficiency is we go through menopause earlier than expected. And there's like specific definitions and parameters. But either way, those eggs don't have that young, youthful quality where they get fertilized quickly, replicate well, all the things we want to do in the early first trimester. So naturopaths have a lot that we can do to help with oocyte aging. And that can include supplements that support egg health and egg quality. Mm-hmm. And when we're thinking about oocyte aging, we're also thinking about as women age, our androgens go down. Androgens seem to be protective of egg quality. Androgens are things like testosterone and DHEA. Another way we address oocyte quality is by addressing mitochondrial health. Mm-hmm. CoQ10 is like a classic supplement that doctors will use to address that. We're also thinking about telomere shortening. And how to address that through herbs and supplementation and exercise, and then oxidative stress, which can be addressed through supplement as well as diet.
And thyroid, of course. We're going to recommend thyroid medication if it's hypo, but also there's potential nutritional support and changes to diet and nutrition that can really support and allow those thyroid hormones to work better. So I see a lot of clients who actually are already taking thyroid medication, but still not actually getting symptomatic benefit from that medication. So their numbers look normal, but their thyroid's not really acting normal.
Right. They're not feeling good.
Not feeling good. Yeah. And
right.
That's a situation where we really help.
Right. Mm-hmm. Absolutely. And I do have a lot of people that will call me with like frank hypothyroidism, not like subclinical, and they wonder if I'm going to recommend medication. And I absolutely do, especially in the fertility world. You do not want to go into a pregnancy hypothyroid.
No, and you don't want to spend the next 6 months nutritionally bolstering a thyroid when you just need it to work, right? Like, exactly. Let's go.
Yes. Right. And then within uterine causes, there's endometriosis, pelvic adhesions, tubal blockages, and other tubal abnormalities.
And so in terms of something like endometriosis and supporting fertility, we as NDs obviously are not able to change structural issues like adhesions. But we can certainly help to reduce inflammatory particles and to help balance estrogen and progesterone, which are typically out of balance with each other in endometriosis, even if they're not frankly or overtly out of balance.
Right.
And in a previous episode, you mentioned the gut microbiome with endometriosis. Can you tell me a little bit more about that and how an ND can help there? Because that is actually not something that I'm familiar with.
Yeah. So it seems that improving gut health via diet and certain supplementation, such as appropriate strains of probiotics, can help endometriosis because endo appears to be associated with increased presence of certain bacteria. And that imbalance or overgrowth of certain bacteria can be rebalanced through dietary changes and probiotics. And when we have a healthy gut, that minimizes reabsorption of estrogens from the gut and allows us to safely remove them from the stool and urine. So when we improve our gut microbiome with probiotics and diet, then that gut doesn't reabsorb those estrogens, which are contributing to this endo picture.
So I want to expand on that for just a second, because this is a really weird concept to get your head around. So basically, humans are designed to be thrifty. And so anything in our gut that's slated as waste, right? It's moving through the tube, it's going towards being just waste and done. We rifle through the trash because, at heart, we're thrifty. We rifle through the trash, look for things that might be useful. Estrogen and other sort of sterol compounds are potentially useful. And so a lot of times, if your body can, it will grab those and pull them back in, especially if your gut barriers are not wonderful, or if you don't have a very healthy diet, like if there's not fiber in there to catch some of those sterols. And so this is actually a huge issue that naturopaths work with all the time. And I've had so many clients be like, okay, no, I'm here for my period. Why are you giving me fiber? Right? Well.
Yeah, exactly. Right. How is this connected?
Yeah, exactly. This makes no sense. I'm not constipated. I just have a bad period. Yeah. No. Yeah. It does make sense.
That's a great explanation. I love that. That's a really good way to put it. So anytime I'm working with an endometriosis client, I'm thinking about their gut health. I'm usually ruling out celiac disease too, because I find so many women with endometriosis have diagnosable celiac disease.
Really?
So if my endo patient, and another interesting thing about endo is it overlaps with so many gut health issues, because some symptoms of endo can be like a lot of bowel changes around your cycle. So sometimes there's like a gastro referral within the endo workup because you're trying to find out what else is going on. So just like a little pink flag to think about celiac too, especially if the endo patient is complaining about a lot of gut stuff.
Well, and one thing I have to say too with celiacs, but also non-diagnosable celiacs, so like just a gluten sensitivity, I have seen a lot of recurrent pregnancy loss where the loss is triggered by an accidental gluten ingestion. And so for my clients, that's one of the things that I tighten up right away, right? When we're talking about losing pregnancies, then any sort of a dietary trigger has to be taken out of there. But it's, these are the ways that natural medicine really can support clients that other forms of medicine just don't, right? Like they're not going into this type of detail and into these factors, right? So it's good to have a healthcare team, not just a healthcare person.
I agree. Yeah.
Okay. Well, thank you. Anything else you want to add?
Well, I think this point you made is really important, which is just looping back to this idea that structural issues typically don't change outside of surgery. And so who do you see, who's on your healthcare team to give you this overall overarching coverage of all the different aspects of your healthcare, and that NDs can't do it all, surgeons can't do it all. And if you can access a team and afford a team, I think you're going to get better outcomes. Yes,
I completely agree. Because ultimately what we want is mom feeling good, dad feeling good, healthy, happy baby.
Exactly. And a bonus is a nicer pregnancy, an easier pregnancy with less reflux, less pain, and less fatigue.
Yeah, let's have those. Let's have those. Okay, thank you, my dear.
Thank you.
Thank you so much for listening today and sharing your time with us. If you like this show, please follow and maybe even leave a review. Or like and subscribe if you happen to be watching on YouTube. Visit naumesnd, naumesnd.com, or to healthwiththat.com for more information about Drs. Kate and me, Dr. Amy.